Rahim. So now let's talk about third degree heart block. This is also known as complete heart block, also known as Stokes-Adams syndrome, right? So in this condition, there is no impulse that is conducting from atria and it reach to the ventricle, right? So atria will be contracting on directions of SA node and ventricles will be contracting independently on the directions of bundle of His. So let me zoom it in so you can see here there is complete AV nodal dysfunction. So there is no impulse that is conducting from AV node. So ventricle will be conducting these ventricles will be dependent on bundle of His and atria will be dependent on SA node, right? So atria will be contracting. We know that SA node fires at the rate of 60 to 80 beats per 60 to 100 beats per minute, and bundle of is they're gonna take over and they will fire at the rate of 40 beats per minute, right? So let me draw the um, ECG pattern here. So we can see here that there is one P wave, then we'll have the another P wave, right? Then we'll have the another P wave, right? Then we'll have this QRS complex which will be brought, which will be dependent on a bundle of His, right? Then we'll have this T wave, right? Then again we'll have this P wave, again we'll have this P wave, and again we'll have this P wave, and then we'll have this broad QRS complex. So you can see here that QRS complex is broad, right? So if you calculate the ventricular rate here from the one R wave to another R wave, so it will be not equal to the PP rate, right? That is atrial rate. So if we calculate the PP rate, it will be around 100 beats per minute. If we calculate the ventricular rate, it will be around 40 beats per minute. So normally what happens, normally we have equal P to QRS complex ratio is equal. So normally we'll have PP interval is equal to RR interval, right? So basically PP interval represents the atrial rate and RR interval represents the ventricular rate. So normally PP interval should be equal to RR interval, right? So in these patients with third degree heart block, as atria are contracting on directions of SA node and ventricle is contracting on the commands of AV node, right? So in these patients we see that PP interval is not equal to RR interval. That means atrial rate is not equal to ventricular rate. So this is also known as atrioventricular dissociation, right? Okay, so these patients, because of the AV dissociation, right? So we know that atria contributes about 30% filling of the left ventricle. So atria are not contracting when ventricle is relaxing, right? So they are contracting independently. So there will be drop of cardiac output in these patients. And the second thing is bradycardia, right? So we can see that the ventricular rate is very low. So bradycardia also contribute to low cardiac output in these patients. And the JVP finding we see in this patient in third degree heart block is called as canon A wave when there is AV dissociation, right? So definitely these patients are going to require permanent pacemaker, right? So the points I want to highlight here is that atrial rate will be not equal to ventricular rate because there is complete dysfunction of AV node. When AV node is conducting some impulses, that is called as Mobitz type 1 block, right? So in this condition there is complete dysfunction of AV node, right? So atrial rate will be dependent on SA node and ventricular rate will be dependent on bundle of His. Since bundle of His fires at its maximum capacity of 40 beats per minute and SA node fires at the maximum capacity of 100 beats per minute, right? So SA node, the atrial rate will be more than ventricular rate, right? So because of asynchrony between atria and ventricles, so there will be less filling of the ventricles, and secondly, as the ventricular rate is low, so there will be drop of cardiac output in these patients, right? So this is called as the third degree heart block. So these patients are going to have the recurrent syncopal attacks due to drop of cardiac output. So they definitely gonna need the permanent pacemaker, right? So that's all for the third degree heart block.